If you look back 5 years, 10 years ago, the way people look at aging was completely different.
Aging was inevitable. Even medical sciences, we used to believe the same thing. What differentiates teenager and between a 60 years old man? One simple answer is the good things are easily can go in the wrong hands. A lot of good things are not approved.
The pharma industry is putting pressure not to get these approved.
It's a controversial question. So I have my personal view, may not be relevant or may not be factual. If the right product is coming for the low price, then you need to be really cautious. Don't buy for these Instamart or someone is offering you very cheap, because they can be labeled here, they can put white powder in it and send you. Very difficult to identify the purity of the product and what it is exactly made with.
What is the point where someone needs to stop?
So we keep changing the amino acid so that the body treats it as different and it starts responding again.
So if there's one peptide that you believe that can benefit everybody,
low peptide work without a healthy lifestyle. So this is take-home message for the talk today.
all the best. So peptides, this have been the talk of the town, not just in Hyderabad, globally. So any fitness forum, this has been the trend. So there's a lot of confusion of how to use them, what are they safe, and a rough introduction about them. So we'll start a series based on that. And we have Dr. Harikiran Chekuri with us. So we'll dig in more insights about this in this video.
I'm Dr. Harikiran Chekuri, plastic and reconstructive surgeon and anti-aging specialist. In this series, we want to demystify a lot of facts about aging, recovery, and science behind them.
If you look back 5 years, 10 years ago, the way people look at aging was completely different. So all they used to be bothered about not having any sort of chronic diseases like diabetes or hypertension. So that used to be the primary concern. But now a lot of people have been concerned about their energy levels and their quality of skin, their muscle levels. A lot of things have changed over last 5 years, 10 years. So how do you feel about it, being in that space of being a surgeon and aesthetics expert?
Great question, Abhilash. Aging was inevitable. 10 years back, this was true. Even medical sciences, we used to believe the same thing. Post 40, 50, there's inflammation in the joints and inflammation in other organs and loss of muscle, sarcopenia, and chronic diseases. Usually they catch up. Now, fortunately, the way science progressed in the last 2 decades is commendable, and the whole topic what we are discussing today is on focusing on 2 aspects. One is how peptides revolutionize this anti-aging space. So with this invent of these beautiful little molecules of amino acids, so-called peptides, intervene a lot of chronic conditions. Let's say inflammation, there are amazing peptides to control the inflammation. There are amazing peptides to initiate the muscle growth, which most of the people who are above 50 were struggling with. And the buzz of the time today is the GLP-1s. They're nothing but peptide. So they changed the game in aging industry. And the next decade is going to be of these molecules, and a lot of research is still going on. The research is not ended. So far, I think more than 6,000 peptides have been identified, and every day the number is increasing. I would assume in a decade, for everything, for every reason we were struggling with, there will be answer from peptides.
So now that in the entire topic of discussion is going to be on peptides, so can you very simply explain for a layman, let's say someone's a software employee or someone's never heard of any medical terms or anything, they're not into biology. Can you explain in the simplest of the terms what peptides are? What are the what are the possibilities? How do they function in your body?
So I'm sure most of you are aware of protein.
Yes.
Protein is nothing but amino acids. It's a bunch of amino acids. These peptides are small branches of them. So there's a tiny pieces of amino acids. So they are also called messengers. Imagine something like a classroom. So when you're young, you go to classroom, it will be bustling. A lot of communication happens between all the kids. Moment you get elder and older, you go, there is a silence. This is what exactly happens in our body. So lack of communication between the cells is one of the major reasons why we don't function well. Let it be energy. Energy needs a lot of communication between cells. So these tiny molecules go and improve the communication between these multiple organs, multiple systems in the body by enabling all of its functions.
Like you've mentioned, as we keep aging, there's a lot of silence in the body. Like if you compare with the classroom, so let's say, why do you think, how do you think aging impacts the signaling process? What are the primary reasons why, as we keep aging, the signaling mechanism keeps dropping?
The fundamental axis, if you know the human body, you look at HPG axis. For any signal, the hypothalamus is a mother, and pituitary is a functionality. It's like a prime minister. So the president, moment it gives a permission, the prime minister will start giving hormones. So that is a pituitary gland. So the HPG axis itself gets slowed down. So what differentiate a teenager and between a 60 years old man? One simple answer is growth hormone, human growth hormone. If you look at that, it's the biggest amino acid sequence of all. So moment you have this reduction of this growth hormone, every function in the body get effects.
Correct.
One of it is energy, muscle, sleep, recovery, inflammation. You name the function in the body, it gets affected with growth hormone, including appetite.
Correct. So previously, when you mentioned growth hormone, a lot of people go for HRTs and all of that. So how is peptide therapy different from a direct growth hormone replacement therapy? I know, peptide, there are a lot of peptides, growth hormone is just one of them. But if you compare a growth hormone replacement therapy or a testosterone replacement therapy with peptide therapy, how do you differentiate both of them? So how is it different?
Growth hormone per se, gives a lot of improvement in multiple things. But in typically medical field, in our field, we actually test their growth hormones, and wherever there's a deficiency, we used to give replacements. And especially in the infants or kids, when they're not able to grow well.
Correct.
So that's when there is a clear deficiency in the growth hormone, we used to always replace it. That's for the medical reasons and therapeutic reasons.
Correct.
Coming to anti-aging, you don't necessarily give the complete growth hormone. So we want, let's say somebody's having lack of appetite. So you know that the GHRPs. So there's one peptide series called GHRPs, growth hormone releasing peptides. So they go typically give a signal to the body to eat. Ghrelin stimulants, so ghrelin agonist. So they go work like agonist of ghrelin, so instantly it improves the appetite. So imagine every function can be mimicked. So we don't necessarily give all the hormones or all the peptides to everybody. We understand where you stand at age, what is the particular concern you have. So these peptides can give you a definite answers and specific answers.
So just to add to that, so you've mentioned GHRPs, most of the GHRPs work by signaling ghrelin hormone, and we all know ghrelin is a very strong precursor for growth hormone.
Yes.
So that's how they're triggering growth hormone
Yes.
pulse or anything.
Yes.
So is it, let's say someone's 50 or 60-year-old, their appetite have been suppressed, and you're really giving a pulse. So is it not prone for overconsumption of calories whenever we give pulse for hunger? How long does the hunger pulse last? And are they prone for overconsumption of calories or anything if we try working out in this mechanism? Talking only for this particular peptide.
Yeah. See, when the appetite triggers, pretty sure the first thing we body feels like having is glucose. But especially when we recommend always, you need to eat clean. So clean eating, your habits can never override peptides. So essentially, when someone is opting these peptides, there are certain basics you need to follow. You need to have good sleep, and you need to avoid excess consumption of alcohol, and smoking definitely slows down most of your body functions, including hormones. So there's no point in adding peptides when you are not able to follow the basic lifestyle, and they're not a magic. So when someone is already in the journey of longevity, recovery, health, then these peptides acts like a push. The peptides alone cannot change you, the person who you are. By just taking peptides, you can't think that you're winning the game. Peptides only think that they are like aiding you. They are like, when you're on journey, probably they'll give you a little lift.
So that's something I always keep telling, peptides cannot overcome bad discipline. So you
Yes.
have to be disciplined enough, and then possibly this can help you a little better.
True.
So let's say, let's start with this. What are your favorite peptides? Or at least, the problems that they solve?
It's a tough
Even
question.
if you cannot name them, at least your favorite set of peptides and the purpose that they fulfill.
Tough question. So I had been in the journey of peptides in the last 2 years. Myself, I experimented most of the peptides. I love GHRH, so CJC 1295 and tesamorelin. These both are GHRH, so growth hormone releasing peptides. And both, I was in a cycle for 12 weeks, weekly cycle. I really enjoyed my sleeps, and I really enjoyed my energy back then. And certainly my appetite was amazing. For a decade I was under eating, thinking that I'm going to manage weight by under eating. Though I'm the industry, but still my beliefs say that overeating is always puts you on weight. So that actually went wrong. So it dropped my metabolism. After taking these GHRHs, and I also combined GHRPs as well. GHRP 6 I've taken, and ipamorelin also tried. So these two combinations are amazing. I think they are like a magic for someone post 40s, post 50s, who is lacking energy, who are struggling with the sleep and poor appetite. So they are going to change your life. So they are my favorites of all. And second thing is recovery. So I had a bad shoulder injury. Typically, it takes 8 to 10 weeks for recovery. So I started using GLOW protocol. So of late, this is a popular trend, that GLOW protocol. So BPC, GHKCU, and KPV. Sometimes I changed with a TB500. So these trio is my second favorite. So one is GHRH, and second is this GLOW protocol. So GLOW protocol, I still use it once in a while, whenever I feel a little inflamed in the body. So I use GLOW protocol. It helps to improve my skin, it improve my hair, it collagen. So there is everything. The inflammation is addressing, then your sleeps are getting better, your recovery is great. So I think these two things something I personally I enjoy about.
Absolutely. So now that you've mentioned both of these peptides, CJC 1295 and tesamorelin. So I have a very strong, conflict always with that, because both the peptides are approved by FDA, but for different reasons.
Yeah.
So they are approved. Tesamorelin is again approved for HIV patients for preventing muscle wastage.
Lipodystrophy, yeah,
And
lipodystrophy.
also CJC is approved for children with stunted growth, like initially when
Yes,
you've
yes,
mentioned
growth
about.
hormone, yes.
And then again they've pulled it back. The restrictions have been imposed again, and then they restricted CJC. But tesamorelin is still available for HIV patients or anything.
Lipodystrophy, yes.
So, why do you think a lot of restrictions have been imposed on these peptides when someone with a HIV history or anything, such a vulnerable people, if it's approved for them, so there is very high probability that general population can get extremely benefited out of it. So why is it approved for certain population and why is it not approved for general population?
It's a controversial question. So I have my personal view, may not be relevant or it might be factual. A lot of good things are not approved because good things are easily can go in the wrong hands.
Correct.
So the very simple, they are the research molecules. If FDA allows them, and there can be misuse or overusage, both of which actually can result into multiple issues. And body can develop antibodies against it. And it's very difficult to control the product once it is authorized and licensed. So I think even FDA is learning of late. I think there was a lot of debate in the last year if you look at the news. And the trends are, they're slowly releasing, sermorelin is officially approved. BPC again, there was conflict again, BPC again approved. And a lot of peptides are again out of now FDA approvals now. They're reconsidering it, but same time they are skeptical about it, because if it goes to everyone, if they misuse it, the complications can happen, as you are aware. I think this is one of the reasons why I think people are a little cautious about it.
So that's one way of looking at it, and of late, even U.S. Health Secretary have been pressurizing the FDA to approve clinical trials and all of that. A lot of debate from celebrities and all of that. So is there a possibility that these are not approved because these things cannot be patented, because these are all biologically available in your body already? So, whatever I've been researching or anything, they're all biologically available molecules. So, anything that's biologically already available cannot be patented. So, is this could also be the reason why, the pharma industry is putting pressure not to get these approved?
So, as you are aware, the GLP-1s are natural hormones in your body. They are incretin mimics. Basically, GLP-1 is nothing but to a lot of people who are understanding it, they are Mounjaro and Ozempic. So they are called GLP-1s. So the biggest companies in the world today are at least the Fortune 500, Fortune 100 companies. Now these Novo Nordisk entered only through GLP-1 manufacturing. Imagine one small amino acid sequence can make trillions of money. Probably the big pharma will have eye on it for sure. So who doesn't want to make money by getting a patency by adding a little bit of sequence?
Without altering the natural
sequence.
So that's the biggest challenge, of course.
The biggest challenge. So there might be things, but nobody is restricting either way. Only thing is, when someone want officially to get taken, then probably you may not able to. But if you really are okay with the research, there are hundreds of options available, like what House of Peptides is doing in India right now. So we are trying to get the best molecules sourcing all over the globe and trying to provide the same facility even in India today. 3 years back, we used to get everything from US and we really used to get difficulty to procure even few peptides. Now we are able to almost deliver 70 to 80% of the peptides in India itself. Especially whoever is okay with these research molecules, they're safe for sure. But the only thing is, someone is really asking for FDA approved, may not. You may have to wait some time.
Correct. Beautifully put. Now that you mentioned, FDA approvals and all of that, that we've discussed. So how do we ensure that the quality of the product is authentic, exactly what we want? Let's say we want CJC 1295. how do we ensure that it is exactly the sequence that we want if you're not getting it from an authorized licensed provider like a big pharma giant or somebody? So, how do we ensure the authenticity of the product?
So unfortunately, unless you have your own biochemical lab, or you're a cellular biologist, or you have back of lab on your own, it's very difficult to identify the purity of the product and what it is exactly made with. But overall, at least with the clinical experience, last 3-4 years I was working personally on these molecules, we are able to identify few companies who is making at least with 90% above purity, which is significantly okay. Because these amino acids, right, it's a powder form, so they're lyophilized form, easy to transport. Even someone can put a sugar there, like it just mimics the same powder. So I strongly tell people, don't go for the cheap tricks. So people say that, let's say, the good peptide is coming very cheap, then you need to be really careful.
True, absolutely.
Because the manufacturing unit maintains certain standards to deliver the product. So I always tell a right price for the right product. If right product is coming for the low price, then you need to be really cautious. Don't buy for these Instamarts, or someone is offering you very cheap, because they can be labeled here, they can put white powder in it and send you. There's no harm in it, but it may not work.
So I have this thing basically. So back then, when we started initially, I got one of the products tested. So it turned out to be growth hormone. So it was meant to be a GHRH, but it's not a peptide, but a direct growth hormone. So just to add to what you've mentioned,
Yes,
so that's
yes.
something all the viewers need to be very careful about the sourcing. It seems easy to source and all of that. One, your guidance is so important, how to follow and all of that, and then the authenticity is the biggest factor. So yes.
So typically, let's say we treat skin. First, let's say someone came with a small fungal disease, and let's say I'm advise some cream, some steroid-based cream and antifungal. I typically assume, I tell them very quickly, use it for 2 weeks and stop it. So I happen to see such situations in my clinic, and very often our clinics, a lot of other dermatologists and practitioners face the same problem. They come after 1 year, and they keep using this for a year. Even after instructions, educated clients, using things unlimitedly, they think that once, okay, this is a solution I can use whenever I want, all the time.
And they become
Imagine the same thing can happen at peptides. So today, one of the major trouble with Monjaro is people unregulated usage is given them resistance now. So people start developing antibodies now. A lot of people are not responding to these Monjaro and Ozempic the way they were responding before, because of continuous usage without giving gaps, and body kind of got resistance to it. So they're not responding anymore. So this is something we can prevent it by expert guidance and frequent intervals and usage of low doses. So suddenly if you try to use higher doses for the quicker results, then you're going to end up with problems.
So now that you mentioned GLPs and how people have been using them, so what I've noticed, people gradually keep titrating, once the results start, halting or anything. So what is the point where someone needs to stop, or ideally I'd say go and meet a practitioner definitely, but if someone's already done it, so someone, who started on their own, is there a way you can do a damage control? So how do we desensitize that situation where they've constantly abused their body with higher and higher doses of GLPs? So is there a way you can desensitize their body and make it normal again?
So we use for any peptide, so we use typically 8 weeks protocol or 12 weeks protocol, and most of the time we cycle them, and we don't give the same amino acid all the time. So what we do in practice, now we have semaglutide, tirzepatide and retatrutide. There are 3 peptides right now, especially for a GLP-1s. So we keep changing the amino acid so that the body treats it as different and it starts responding again. And sometimes we combine these two. So that is again typically the clinic practice I'm talking about. So we combine sema and tirazepatide and reta. So by then, so we kind of confuse the body to get the same response. Second thing, I personally believe, I try to titrate to the lower dosages most of the time. I forcibly give drug holiday. So at least 4 to 6 weeks off I give by keeping some oral supports. Especially we use metformin, we use berberine, because hunger comes back and they're going to again gain weight. So in that particular period of interval time, so we have to add some kind of appetite suppressant which is safe, and once the interval happens, when the interval over, then probably we try to start back again with the lower dosages. I think this is something worked for us, and there's no standardized protocol for it. But essentially, two things are important: giving gaps and sticking to the lower dosage and changing the amino acids. I think these three tricks, if you can use it wisely, I think probably you can avoid most of the resistance what you're considering it.
So, do you usually face any challenge with any of these clients with protein intake or lethargy and all of that? Because, GLPs are prone for extreme appetite suppression. So it becomes a challenge to consume enough protein, and they've been on a transformation journey. So protein plays an equal role, and their even workout levels matter so much. Like we discussed earlier, nothing can overcome bad discipline. So for them to be on track, so without any calorie consumption, limited calorie consumption, so their body feels very reluctant to go to the gym and work out or do any sort of weight training or anything. Protein consumption also becomes challenging because protein itself is boring, for a lot of people. So in considering the appetite is suppressed drastically, so do you think it's a challenge for a lot of members?
I'm sure you're in the fitness industry, so pretty sure it's very difficult for someone who's all in a GLP-1s to consume a lot of calories. In terms of protein, it has become more challenging. What I particularly tell people, let's say it works for 6 days, typically any GLP-1 drug, long-acting drug, 7 days, 6 to 7 days. So first 3 days, the drug is at peak. So actually it doesn't allow you to eat anything. So I tell them, but at least my practice, what I tell them is, I tell them to take a lighter protein. I suggest people for iso-whey in the simplest form, in the liquid protein. Liquid proteins are very easy, they're just like water, but same time they're able to give the protein required for the body. We are delivering the recommended protein for the body. Last 3 days, 2 days, when the hunger comes back, generally I ask them to go for a solid protein, white meat, fish, poultry, whatever. I think by this, so I think we are able to get my requirements for my clients, at least I'm able to meet right now.
So this is one reason why I've always been, not a big fan of GLPs for that reason,
Yes.
So whenever I recommend anybody, I usually avoid GLPs, Reta being an exception. If someone cannot follow diet no matter what, they've been having extreme cravings, and irrespective of what I put them through, they're not able to follow, then I recommend Reta. But other GLPs I've never been a fan, because of the same reason where, they don't consume enough protein.
Yes.
It becomes very challenging. So that apart, what are the other challenges that you usually see, with the clients? Are there any sort of side effects with any of the peptides? I mean, there are numerous peptides again, so everything might have a different thing. But are there any common side effects?
I think, see, today peptides are in a hype. So a lot of Gen Z, I get to see every day at least a couple of clients who is under 20, 22, asking for a growth hormone supports. So probably they get followed with this extreme Insta trends by celebrities. They don't understand the celebrities who are they're following are most of the time they're 40 plus or 50 plus.
Exactly.
So you need to understand a 22 years boy who is eating healthy may not require growth hormone peptides. He might need peptides to control his cut his pain, maybe inflammation, recovery, like a BPC TB 500, but not growth hormones. So I think we should have a rationale and some kind of advisory, especially for who is really getting followed with this, followed by these Insta trends, especially in Gen Z kids. So I think we need to be a little cautious about it. So we need definitely. I would recommend anybody who is want to start the peptide journey. Don't just follow the Insta. Meet an expert in your city, whoever is available. Take the advice and suggestion whether you are actually required that peptide or not. By then, so you're unnecessarily wasting money and you're wasting time as well. But which you might get the same benefit with a fitness expert and with a good diet, good sleep, you may get the same benefits. So better not to waste peptides for someone who actually don't need it.
So that's one reason. And second thing, they fit into quite expensive brackets usually.
Yes.
So depending on the protocols, it can range quite high also. So if you mentioned your favorite protocols, but would you say is there any one peptide that can benefit anybody, irrespective of age, irrespective of gender, irrespective of their lifestyle? So if there's one peptide that you believe that can benefit everybody, so
GHKCU is one among them, and a BPC for sure. So probably you can add some. I think these two things.
So my favorite has always been Epitalin. So yeah,
Bio-regulators.
Yeah, so Epitalin, I'd call it the superhero.
Yeah, Bio-regulators.
So,
Bio-regulators we didn't discuss much about in this episode. I think
I'm
we
sure
should
have another episode about Bio-regulators.
There is something called Bio-regulators, which is actually started one of the Russian scientists in early 80s by name Kavinson. So he's the one who pioneered these Bio-regulators they kind of regulate entire system. Like Epitalin, now we have bronchogen, we have Vesugen, Pineolon. So there are a lot of bioregulators now. So all these are the kind of game changers. But yes, I'm a big fan of Epitalin because I especially use this Epitalin for sleep recovery. Someone is struggling with a bad sleep. So I had an incident. I think I want to mention one of the young fitness enthusiasts. She's at 40, 45. She's very healthy. She eats healthy, eat clean. There's no issue, but she's not able to sleep. And she doesn't want to use any of these sleeping pills. I've told her, I use the lightest dose of Epitalin just for 5 days. For 6 months, she was thanking me every day. Her entire cycle is kind of restored. So someone who is clean, mind this slowest doses of these regulators will give you enormous benefits. Oh, I am a big fan. I totally forgot about it.
So that's one thing I've been using for last 10 years, constant on and off. So my favorite, I'd say. And again,
this is something called Fountain of Youth. So one peptide which is master of all is Epitalin. I totally agree with that.
And then I am also a big fan of bronchogen. So bronchogen,
world needs it. Most of the smokers actually.
Yeah, I can't name the celebrities, but they've been spending millions going abroad and getting their lungs cleaned.
Yeah.
So, but this is quite useful, I'd say.
Yes.
And yeah, these are two of my favorite, along with CJC again. So
to summarize today's talk, the peptides are very promising, but you need to be cautious about it. And there are hundreds of peptides available. Be careful about the sourcing where you're getting from, and always take expert guidance before you start using them. And low peptide work without a healthy lifestyle. So this is a take-home message for the talk today. Abhilash, you want to add something?
Yeah, so that's it. So be very cautious. Don't go for easy sources. Always ensure the authenticity is good, even if you believe how to use the product very effectively. It is always important you make sure the source is very, very, very accurate, because you're injecting something into your body. These are injectable compounds, so it's good you be very cautious. So all the best.